thank you everyone for taking the time out of your day. I know that time is definitely that non-renewable resource, and it really means a lot to me. And thank you again for joining us. So today I want to talk a little bit about the nurse practitioner role, how they're valuable, and we'll kind of go over a little bit of an outline. But I want to introduce myself first. My name is Matthew Jubalius. I'm a registered nurse, coming on about 20 years now. And this Virtunurse has made me feel like I did the first week of nursing. I'm lit up. I'm passionate. I love it. And I've had a lot of experiences in a wonderful career in nursing, everything from healthcare leadership to actually dementia care support groups, facilitation, client services. And, you know, I again have been very fortunate because as a nurse, I've been able to see a lot of people. You get to connect with people, and that's something that I love, that I think is a privilege. So I also want to pass that on to you. It's a privilege to be here today. So today, again, like I said, the title of our presentation is Nurse Practitioners. They're valuable for caring with someone. And what we're going to do is we're going to cover the role of a nurse practitioner, some of the services they provide, how they support caregivers, an overview of Virtunurse, and an integration with Team CarePal, because I say that healthcare is a team sport and nobody has the one solution. This is definitely a holistic and a collaborative approach. And we'll finish up with a little bit of testimonials and some contact information where we can continue the conversation, where you can ask questions and so on. So within Canada, and specifically Alberta, the role of nurse practitioners is really increasing. We're dealing, like, we as in the healthcare system, unfortunately, is struggling. The traditional models are crumbling. The needs of patients have increased. The complexity of patients have increased. And from a human resources perspective, physician seats in terms of general practitioners, family medicine, they're going unfilled, which means the supply is not meeting the demand. The expansion of the nurse practitioner role and is actually vital. And I think that we're going to see a lot of that increase nationally, and within each province, there are different initiatives going on to increase basically the needs to support patients. Nurse practitioners assist in diagnosis and treatment. So they are graduate level, master's degree trained nurses. So they are registered nurses, but they have that master's degree level. They've also completed additional specialty training in community health and all of that kind of family practice elements, whether it's mental health, whether it's all ages. So there are different streams that people can go into. And after one is a nurse practitioner, they are licensed by the College of Registered Nurses of Alberta, so CRNA, and each province with their regulatory bodies respectively. So essentially, nurse practitioners have a similar level of authority as a physician, which means that they can diagnose, they can provide and prescribe a treatment plan. So whether it's that, for example, medication, so they have the authority to prescribe medications, order lab tests, order blood work, diagnostic imaging, and provide referral to specialists. So for example, let's say somebody needs a CT scan and they are, referred to a specialist or nuclear medicine or anything like that. A nurse practitioner has that level of authority. So what does a nurse practitioner mean? It really is about comprehensive care. And again, as I mentioned earlier, healthcare is a team sport. There is no one specific silo. And one of the things that I can add from my nursing journey is to be able to view different points and different resources that are available. And the field of nursing really is that comprehensive view. So that's something really valuable that nurses provide and nurse practitioners provide. We at Virtunurse as well, shifting the model to health promotion and disease prevention. And the statistics in Canada are such that chronic diseases are increasing at 14% per year. And almost half of Canadians have some sort of chronic disease. Um, it it really is something that needs to be addressed. And again, the role of a nurse practitioner in order to provide support in a team to manage chronic diseases such as diabetes, cancer, high blood pressure, so on, is extremely vital. Because again, when we look at a supply and demand, a shortage of family physicians, we need as a team, a healthcare team, regardless of any region that you're in, we need to collaborate and we need to work together. The days of silos, unfortunately, have to end because our patients they cannot afford that in their health. Again, focusing on holistic care, that comprehensive care, looking at saying, the integration of what does massage therapy look like? What does acupuncture look like? And ensuring that it is a team effort. So when we look a little bit further at nurse practitioners and their services, primary care we mentioned, that's kind of like your family all ages aspect. Nurse practitioners can also provide and pursue specialized care, whether it's mental health, critical care, pulmonary care, and so on. Really, a nurse practitioner can choose their own adventure, so to speak. And I remember when I was a nursing instructor, I would always tell my students, now you get to choose what kind of nurse you want to be. You get to choose if you want to pursue more education. And, as I've worked with a lot of nurse practitioners and a lot of nurses, um, it blows my mind to see where people have actually gone because the level of specialty and the flexibility of nursing as a career choice, fantastic. So also nurses are educators. It's not necessarily just about providing a prescription and saying, see you and have a follow-up kind of deal. It's also about educating our patients. So at Virtunurse, we are definitely about, providing that personalized care and educational support to help people make informed care decisions. Because again, imagine not having access to a medical system, and then you're thrust into the role of being a caregiver. There's a lot of education that's needed, and the learning curve is pretty steep. So again, we want to provide that education, and nurse practitioners are experts at that. Further, when we look at emotional support, right, caregivers, and I'm sure that it is a over full-time role. It's a 24-hour role. It's always on people's minds. And when we look at the levels of burnout, and we'll talk with Team CarePal a little bit later about the caregiver burnout index, um, the challenge of navigating the healthcare system itself can be emotional. There are many ups, there are many downs, there are many unfortunate barriers where you ask, why can't we make this simpler? Why is it this way? And again, you've chosen to be here today, so we're going to show you how we can reduce those barriers. When we look at nurse practitioners supporting caregivers, again, that comes with my previous point of education. But again, the specialty, the gift that nurses have for the most part, again, to connect with people and on humanity is something actually very, very special. And nurses as a trusted role to be able to have that one-on-one conversation, to build the relationships and say, you know what, I'm not doing well. This isn't about judgment. This is really about providing the emotional support for caregivers because, again, you are in that role, and the nurse practitioner and registered nurse role is there to support and help navigate. We do this for caregivers, as mentioned, but also, again, as patients. If we back off a little bit and kind of take an overhead view, when it comes to stress, if you're a caregiver and you're not providing self-care for yourself. And, that has a lot of meaning in its own, the word self-care. Then what happens is, someone can become, stress elevated. I call it redlining for a while. You're giving it all you can with your engine, and all of a sudden, poof, you hit burnout. Now you become a patient. Now you're needing the healthcare support. And are you functioning and are you supporting your loved one? Finally, nurses, registered nurses and nurse practitioners help in decision-making support, navigating the healthcare system, but again, working together with patients to make the right decisions for them. Providing all of the options that are available to have the patient and the caregiver make an informed choice. I look at it this way, and I tell my patients this: you're in the driver's seat, or another analogy is that the patient or caregiver is at a table and we get to sit at that table with you, but who else can we involve at that table? And again, this is that, analogy to a team sport, to a team initiative. And it really takes a team. I had the opportunity through Virtunurse to meet Cindy Sim from Team CarePal, and she'll speak in just a couple of moments. We realized some natural passions and missions, and man, when we met, I want to say it was electric, because I met someone as passionate about helping people as I am. And that gives me even more passion, if you can believe it or not, to help support our patients, to support caregivers. So we are a resource with Team CarePal. And what does it really mean? For our people, it means outstanding support for caregivers and families. Their platform increases communication. Most importantly, time and energy saved. Again, time is a non-renewable resource. And finally, coupling with Virtunurse, trusted professional care. So I'd like to hand it over to Cindy Sim. She's the CEO of Team CarePal, and she'll talk a little bit more about the impacts, and then we'll go through Virtunurse and continue the conversation. So Cindy, please go ahead.
Thank you so much, Matthew. And I appreciate everything you're doing. And I absolutely cannot agree more on what you said, where it takes a team. It takes a lot of people to come to the table, whether they're dementia coaches, whether they're physiotherapists, whether they're nurse practitioners, whether, it takes everybody to come together to support the caregiving journey. And that's exactly what Team CarePal's mission really is behind the scene. Yes, I am the CEO and founder of Team CarePal, and we really support that family caregiver throughout their journey by using technology, by bringing together community and bringing that education to the table. So right now, currently, family caregivers make up this country's largest group of healthcare providers, and yet they are unrecognized, unpaid, and more often than not, completely unsupported. Right now, 1 in 4 Canadians are family caregivers, and this is down in the US as well. 50% of Canadians will be caregivers in their lifetime. In fact, like, our aging population right now is going to double in the next 10 years. So we really are at that crisis stage, because our caregivers are starting to hit burnout. They actually provide 90% of care in our communities, day-to-day care in our communities, and 30 to 40% of care in long-term care homes. So while caregivers, family caregivers are managing, maybe they have kids, their jobs, their day-to-day lives, they're also caring for their loved ones in their off time. And what happens is they start to burn out. And we've seen this more and more and more as it increases across the nation. When family caregivers burn out, their loved ones risk, suffering. Their loved ones will end up in long-term care homes. We know 1 in 9 long-term care homes are filled unnecessarily because caregivers have burnt out. There's not enough supports in the home. And so this is, where Team CarePal comes into place, where we come and we connect with Matthew and organizations across the nation to connect them to family caregivers. Family caregivers have no idea where to go to manage what they're doing or where they can go to get support. And so we do all that in Team CarePal app. It is an all-in-one management solution for caregivers and their families to come together for their loved one. We offer a hub for communicating, scheduling, delegating, and they get to track all aspects of care while providing that customized resources to support their journey. And of course, Matthew's in there as well, Virtunurse. These are all the incredible tools that we use to really help caregivers manage their journey. One of the pieces in here is called the Caregiver Burnout Assessment Tool, and I really want to focus on that today, because this, assessment is for the caregiver to do on a weekly basis. They can go through and ask some questions, and then it actually tracks on a graph where they're at in their burnout levels. And this is very, very important because, caregivers need to start looking after themselves. They need to be aware of where they're at. And when they do start to see, them graphs start to, the burnout levels start to rise, we really want them to reach out to people, like our navigators in our app, or like Virtunurse, who is in there just ready to help you. Nurse practitioners are there. They can help support your mental health. They can help you with your questions with your loved one while you're caring for them. There's just so many great things that they can do. And so, yeah, this is just a picture of the app. So we really do go hand in hand. Navigation is such a big one. Some people are caregivers, for just an acute period of time, where other people, it's chronic, 5 or more years they're caring for a loved one. It can happen throughout their lives. It can happen suddenly overnight, a diagnosis, a car accident, and then all of a sudden, information is thrown at you from all different directions. And so we are really the resource and the tool and community that family caregivers can use to go through their navigational journey.
Thank you very much.
Matthew's our guy. Virtunurse is our trusted healthcare provider in Team CarePal, and we absolutely love him and couldn't be more thrilled.
Thank you so much, Cindy. Appreciate it. I'd like to step into Virtunurse a little bit more specifically now and talk a little bit about it. We'll go to the little bit of the dashboard to the website. And again, the purpose here is to provide that education and then to start a conversation. Please reach out again. So when we look at Virtunurse, and I want to start off with why. So why Virtunurse? Where I live, I found that there were no family clinics taking new patients. So where do people go? Again, I've been in healthcare for 20 years, and this is not a new issue, but we know that the pandemic exacerbated a lot of, again, infrastructure on the healthcare system, human resources, and so on. So when we look at the journey of a patient and a caregiver, okay, so I need healthcare and I'm going to go to a family clinic. And what happens? Sorry, we're not accepting patients. And this is what happened exactly where I live. And so I started thinking about the journey. Okay, so the person goes to a family clinic. Sorry, we can't get in there. Then they go to a walk-in clinic. Sorry, we can't see you today. We're oversubscribed. Okay, then where do people go? Well, they end up in emergency departments. And when we look at the role of an emergency department and an emergency department team, it's different than primary care. It's different than chronic disease management. It's different than mental health. Okay, again, they're there for emergent situations, critical situations. So what happens when somebody needs a prescription? They need a renewal. What happens? So these are the things, these are the questions that I asked. And I said, you know what, we need to do better. We can do better. There is technology available. And more importantly, there are people that are passionate and care. So that's why I started Virtunurse. And quite honestly, I am where I need to be. I am fulfilling my dream. And I'm so thankful, again, even just to be here talking to you today, because this is the why. This is why I do what I do, and I'm very fortunate. So at Virtunurse, we provide convenient care to nurse practitioners, registered nurses, and also registered psychiatric nurses. So from that clinical level, prescription, diagnostic imaging, lab test request, helping manage that chronic disease, we can see a nurse practitioner. We talk about health management, coaching, and so on, lifestyle, workplace stress, and so on. We can talk to registered nurses. And when we need to specifically focus on mental health, again, related to burnout, related to all of those things that go on with caregivers, we actually have registered psychiatric nurses. Their specialty is in trauma. Their specialty is in loss, anxiety, grief, and all of those emotions and experiences that caregivers especially go through. So we are an ecosystem where we can help from that healthcare perspective a lot of different patients. And I have to give a shout out to our team. Thank you. We have people that care and are passionate about what they do. And this is what makes us successful. And it's not possible to do without our team, because they are healthcare architects. They help design the plans. They help provide the service. And again, it's a privilege when I get to see patients as well and help them. That's the stuff. That's the stuff that feeds us, that feeds our team. And those are the people who we work with. And again, thank you to our team. So you are able to access comprehensive health resources. Again, it starts with a conversation. And then based on your journey, that's where we say, okay, well, now we need to go down here. This is the education that we need. Maybe we need to talk about this resource and so on. And we provide that personalized guidance. And again, everyone's journey is different. And we have to recognize, and we do honor that. We know that everyone is different. You know, we're people. People are highly complex. And we want to support and provide that specialized, personalized journey. So let's go to our website. Let's take a look a little bit here. And please let me know if you can or cannot see this. You should be able to see this. Is that correct?
Yes,
Perfect.
we can see.
Thank you. So this is our homepage. And currently we function within Alberta, and we will be expanding nationally throughout Canada later in 2024. It's a little sneak peek announcement. But when you come to our home, we open the door to our home to you and say, come on in. This is where we stand out differently from the traditional system. We put you in that driver's seat when it comes to care. So not only do we just say, hi, this is what we offer: prescription and medication refills, diagnostic and lab imaging services, health assessments and referrals, mental health support through chronic and acute care. This is a little bit of our team. So you can actually read each person's bio and say, you know what? I feel like I will resonate with Angela, or I will resonate with Jessica or Ruby or myself. You get to pick the practitioner. And again, in that traditional model, you get what you get. You know, we know that clinically there's better outcomes when people work together. So if you're not having a great relationship with your practitioner, we don't take it as a personal attack. You can switch. You are not attached to that one person. We still provide the same level of care. And again, our goal is to help support you. This isn't about us. This is about you. And I really want to be clear about that. So what happens when you want to book? Well, obviously, you're able to just take a look at our schedule, and we'll just pick me, for example. This will take you right to our booking site, and we make it easy. We start taking a look at different services. So this, again, helps us understand what we're doing. So, you know, if you're a new patient to our clinic, you know, click on this one. It gives us just a little bit longer to build that relationship, to say, you know, this is what the plan is. This is what we need to do. But again, this is about relationship building. Providing mental health support. Again, I provide mental health support, but I'm not a registered psychiatric nurse. I don't have the same level of training and focus and specialization as Jessica, for example, our registered psychiatric nurse. So again, depending on the situation, you might book in with me, but then I would say, you know what? Jessica might be the person who you would get most value from. And again, it's not personal. It's just about making sure that your needs are met. Again, we can talk about different levels, and basically we click, we book, you're able to see availability, and you're able to say, okay, new patient intake with me, and that will start the process kind of deal. And this is the start of our intake document. I'm going to just exit out of this. Yes, I do want to leave. Thank you. And I want to go back to our presentation because this is the start of our intake. And at Virtunurse, we have this kind of level. We go through every single body system, and this tells us a lot more about our people, our patients. And another special thing that we have with Virtunurse is that we are authorized by the government of Alberta to have access to provincial healthcare records. That means that we can see all the medications you've been prescribed. We can see all of the hospital care that you've had. So between our comprehensive intake document and referencing our provincial healthcare records, we have all of this information at our fingertips. It's safeguarded, it's secure, it's protected, and we have additional security layers on our software platform to ensure that that is protected information. But what does that mean to you? You're getting even better, more thorough care before you start talking to our team. So essentially, this is how we support caregivers. In 3 easy steps, we reduce stress, we provide increased confidence, and enhanced well-being, because people are getting the care that they need when they need it, but you're getting the right care from the right people. Again, you're not going to an emergency room talking about chronic disease management and caregiver burnout and stress. That's where we are able to provide capacity, and we're the people that we want, to speak with people for those concerns. Emergency rooms, again, it's about access, and sometimes we're just scrambling to get all the access we can. We are here to provide that support. Like I said, right now to Albertans, we service all of Alberta, and we will be expanding nationally later in 2024. I can talk all day about how good Virtunurse is, but it's about our people. And I wanted to share a few little testimonials that we've received from people that we work with, patients, and so on. We believe in having a positive impact. So fast, efficient, and competent. Talk about that in 4 words. So again, our team believes in continuing education, making sure that we have the right up-to-date treatment standards. And what does that mean? It improves people's happiness because they're getting the proper care. And we have a lot of people that come back to see us over and over again, because not only of the healthcare, but again, the service. One of the common things that we hear from our patients is, thank you for listening. And I know that I don't want to downplay that, but sometimes we are bound by time. And again, well, we all are bound by time. It's a non-renewable resource, as I talked about. But when we're able to have a little bit of that time to focus on people and provide the right care, again, Virtunurse as a primary care clinic versus an emergency. And again, it's nothing to take away from emergency, but those folks, that's not their specialty area. We're able to provide that support, and people keep coming back to us. And finally, again, enhanced support. Booking an appointment, again, I showed you how easy it is. Again, I think it was like 3 or 4 clicks or something like that. And this is about supporting people. So the opportunity to work with Team CarePal and be integrated as one of their resources is, again, a privilege. I really want to stress that. Through nurse practitioners, we're able to enhance patient care, again, and create capacity for the healthcare system. We're able to focus care where it should be. And Virtunurse has, is paving the way for future clinics. We are the first nurse-led online clinic that I'm aware of. And we want to definitely set that bar high, which is why we have a lot of standards and a lot of special privileges, again, working with the medical community. We work as a community resource. We don't compete. So what does this really mean at the end of the day? Combining Team CarePal with Virtunurse reduces barriers. And as I've spoken a little bit earlier, and as Cindy has spoken, it is about making effective use of your time and your energy. So being able to talk to the right people who can help caregivers navigate the healthcare situation for themselves and for their loved ones is vital. Again, when we talked, and one of the themes that we've talked about today is time. We want to be effective with your time. We want you to have more time with your families, with your loved ones. We want you to have more time and energy to focus on them, because that's what it's about. You shouldn't have to waste time being told, no, you can't go to this department. No, this is the wrong department. No, and so on and so on. Again, that's kind of been the status quo. We, again, together through technology are able to reduce those barriers. And that's one of the reasons why Team CarePal and Virtunurse are able to work together. So it is about quality of life, and it is about families, because it's about our people, plain and simple. Our loved ones matter. So that comes to kind of the end of the formal portion of the presentation. I really appreciate you taking the time again. Let's work together. Reach out to our organizations. You can, email us here at Virtunurse, hello@virtunurse.ca, or you can call us again, 403-977-5220. Let's have that conversation. Let's see what it looks like to provide that support for you. And also through Team CarePal, admin@teamcarepal.com. This is, again, a collaborative effort, and that's why we're here today. So thank you again for joining us. Please reach out if you have questions. Thank you again.